Hi, my name is Dr. Sheila Dovey, and today we're going to be talking about sleep apnea and how to get some good quality sleep. Good quality sleep is important for so many reasons, including it's time for the body to repair itself, it's important for immunity, memory consolidation where the brain sorts out all the memories, and it's necessary to keep you alive and healthy. 42 million Americans have some kind of sleep disorder. 1 in 5 have severe obstructive sleep apnea. 1 in 15 have severe obstructive sleep apnea. It's one of those things that goes hugely missed because a lot of general doctors are not asking their patients about sleep. Let's first talk about normal breathing. Normal breathing is when oxygen that we breathe in is easily able to flow down the nose, into the airways, into the lungs, and the body can use the oxygen that it needs. Sleep apnea is when the airflow stops for more than 10 seconds. Basically, breathing stops. In a mild case, it's 5 to 15 events that happened in 1 hour. In moderate, it's 15 to 30. And in a severe case, it's over 30 times. Sleep apnea can lead to a long list of health issues. The heart can get affected, and here's a long list. Sleep apnea can also cause abnormal blood gases as there's an inefficiency of oxygen exchanged, stress on the heart, increased inflammation mediators, and an increased chance of heart failure. Basically, on the heart front, sleep apnea can cause heart attacks and stroke, and nobody needs that. By the way, studies have shown once sleep apnea is treated, it can actually cause a reduction in blood pressure. Sleep apnea can also lead to memory loss, daytime sleepiness, impaired quality of life, metabolic effects, and even cancer. Sleep apnea is associated with metabolic dysfunction such as glucose intolerance and insulin resistance. Studies have shown that 50% of patients with type 2 diabetes have sleep apnea, and sleep apnea is an independent contributing factor to insulin resistance. So new studies have shown that treating sleep apnea can actually improve blood glucose control and insulin sensitivity. Now that we understand the importance of sleep, let's see if you or a loved one is at risk. Risk factors include males above 50, postmenopausal women, ethnicity, especially Black, Asian, and Hispanics, and anything that causes an anatomical obstruction, for example, an abnormal structure of someone's nose. Many people don't have any signs and symptoms, but here are a few. Snoring, daytime sleepiness, an inability to sleep at night, including insomnia, morning headache, dry mouth, sore throat and sinus, and nasal congestion, mood issues, memory and learning problems, impotency, and bedwetting. There are a few tests that can show you if you have a high likelihood of having sleep apnea. I'll put it in the show notes. Obesity is also a risk factor. When someone loses weight, they lose the fat around the neck and it opens up the airway and allows them to breathe better. So in my office, we make sure that every patient is evaluated for sleep apnea. We're looking at the position of their jaws, we're looking at the back of their throat, and we're giving them a full assessment of the risk factors of sleep apnea. Make sure, if you're not a patient of ours, that you find a dentist that can accurately diagnose and treat sleep apnea, because the correct diagnosis can actually save your life. So don't worry if you think you have sleep apnea. First of all, discuss it with your medical doctor or your dentist, and they can refer you to a sleep specialist. Now, how is sleep apnea treated? There are two main ways. First is by making a positive pressure appliance known as CPAP machine. And the second is a device that the dentist who is trained in sleep apnea can make that moves the jaw forward so that the airway is opened up so that you can breathe properly. So don't worry, there are ways of treating sleep apnea. You just need to find the right dentist and the right specialist. Now that we've talked about the importance of sleep, I'd like to give you some helpful tips. Number 1, sleep in a completely dark room. If you can't get the room dark, just wear some sleep masks. Number 2, the best time to go to sleep, studies have shown, is before 10 p.m. Number 3, go out in the sun for at least 15 minutes in the day, and this actually helps with the production of a sleep hormone in the night. If you do have difficulty in sleeping, there are many apps out there that can help, such as BrainTap and Calm. These will help calm your mind and allow you to get some deep quality night sleep. I'd like to touch on children and sleep. If your child snores, you need to consult your pediatrician. It is not normal for a child to snore. It is very crucial that children have enough sleep. When a child is not getting enough sleep, they don't have a chance to restore and conserve the energy that's needed for memory consolidation. If a child does not get enough sleep, he or she will be falling asleep at school, and that will lead to other consequences. They will have difficulty in concentrating, memory lapses, loss of energy, and a lack of initiative and emotional issues, and sometimes hyperactivity. Sleep can be overlooked as a cause of many issues. Children can even be underperforming at school, and they can be deemed troublesome, when reality is that they just need enough sleep. Well, I hope that was useful. Here's to a good night's sleep. Don't forget to take the questionnaire to see if you are at risk of sleep apnea.